Let's begin with our topic of disorders of the oral cavity, and let's begin with the section 1, in which we will talk about the anatomy of the oral cavity and also the lymphatic drainage, where the lymphatic fluid or drain into from the oral cavity. So lymphatic drainage of the oral cavity, and also we will talk about some disorders of the oral cavity in this first section of our lecture. So first, the anatomy of the oral cavity. I keep on repeating the basics of what is anatomy, what is physiology, and then what is pathology, histology, cytology. So we should know these basic meaning of these basic words used in the medical terminology very commonly. So anatomy is the study of the structure of the part of the body or organ of the body, and then physiology is the study of the normal function of the body. Pathology is the study of the abnormality or disease process. Similarly, when we talk about histology, histo is the tissue, so histology is the study of the tissue, cyto is the cell, cytology is the study of cell. So as we keep on going, embryology, embryo is the growth of the baby inside the uterus. So embryology is the study of the growth of the baby. So all these are the different subjects related to the medicine. So anatomy of the oral cavity is the normal structure of the oral cavity. So components of the oral cavity, mainly this is the structure of the oral cavity. We have the gingiva, the gums, and then there is a tongue, hard palate, which is in front. If you touch your tongue to the top or roof of the oral cavity, the front part, which is hard, that's the hard palate. On the back is the soft palate. This is the uvula hanging down. If you open the mouth and see the mouth, there is uvula hanging down. So this is the basic anatomy of the oral cavity: tongue, uvula, gums, hard palate, and then the outline by the teeth or margins. So this is the components. We have lips and buccal cheek mucosa. Cheeks are also known as the buccal. So lips and buccal and cheek mucosa. And this mucosa, it lines the inner surface of the cheeks and lips. So inner surface of the lips and the cheeks is lined by the mucosa. This mucosa of the oral cavity, or the mucosa that lines the lips and the cheek, it extends up to pterygomandibular raphe. Here we have this lower jawbone is the mandible. So this is the mandibular ramus, and then on the back pterygoid plate and the mandible is present. So it extends to the pterygomandibular raphe. Then we have gums. Gums are known as the gingiva. Gingiva, we have, it surrounds the teeth. So all this red portion that surrounds the teeth is the gums or gingiva. Covers upper and lower alveolar ridges, upper and lower alveolar ridges, which contains the teeth. They are lined by the gums or the gingiva. Then the retromolar trigone. Retro is behind the molar teeth. There is a trigone known as retromolar trigone. It covers anterior surface of ascending ramus of the mandible. Mandible is this lower jawbone, and ramus of the mandible, it covers the anterior surface of ascending ramus going up. So ascending ramus is covered anterior part by the retromolar trigone. and base is posterior to last molar. So base is posterior to the last molar tooth. Then we have hard palate and the tongue. Hard palate and the oral tongue. Tongue is a long structure, but the structure or the part of the trunk that is present in the oral cavity is known as the oral tongue. And then we have hard palate, as I mentioned. If you touch the tongue to the roof of the mouth or the oral cavity, this structure in front is the hard palate. So hard palate and the oral tongue, tip, lateral borders, dorsum and under surface. So the anterior two-thirds of the tongue is in the oral cavity and the posterior one-third of the tongue is in the oropharynx or part of the oropharynx, which is behind the oral cavity. So the oral tongue is the anterior two-thirds of the tongue. Then the floor of the mouth is between the gingiva and the gums and the under surface of the tongue. So floor of the tongue, if the tongue is elevated, the lower portion of the bottom of the tongue when it is elevated is the floor of the mouth, and it is lined by the gums or gingiva and the under surface of the tongue. So that's the floor of the mouth. And there is frenulum and some sublingual papillae. Sublingual is under the tongue. Lingua is the other word or the name used for the tongue. Sublingual is under the tongue. Frenulum is, if you lift the tongue like this, the bottom part below the tongue which attaches the tongue to the floor of the mouth, that's the frenulum. So that is also present in the oral cavity. So if we revise it quickly, so we have in the anatomy of the oral cavity, we have the lips and the cheek mucosa. Then there are the gums present, retromolar trigon, and then we have hard palate and the oral tongue. Oral tongue means the anterior two-thirds of the tongue is in the oral cavity, and then we have the floor of the mouth. So here again, if you see, we have the gums and then the hard palate, then we have the oral tongue. This is the uvula, and then if the tongue is elevated or moves upward, there is the frenulum, and then we have sublingual papilla present on the floor of the oral cavity, and then there is the retromolar pterygon also. All these parts makes up the anatomy or the structure of the oral cavity. Next, the lymphatic drainage of the oral cavity, where the lymphatic fluid goes and drains from the oral cavity. So lymphatic drainage of the oral cavity is from the lips. It drains to the preauricular. Preauricular means behind the ear. Auricle is for the ear. Preauricular lymph nodes. Then we have parotid. All these words are more or less self-explanatory, because if you divide them into the two word parts, infra is below, parotid is for the parotid gland, which is the major salivary gland. So we have infraparotid lymph nodes. Then the submandibular. Submandibular is below the mandible. All these are the lymph nodes where the lymphatic fluid or lymphatic drainage of the lips goes to. So these are the lymph nodes. Also, we have submental. Submental is below the chin, mental is the chin, and lateral part of submandibular node, so lower. One goes to the lips goes drain to the upper nodes of the submandibular, and then the lower part of the submandibular nodes. So both are drained, lips drain both to these nodes. Then we have buccal mucosa. Buccal mucosa is the mucosa that lines the cheek. They drain into submental and submandibular nodes. So the lymph nodes present around the oral cavity, we have submandibular, submental, then we have infraparotid lymph nodes and preauricular. These are the lymph nodes which are present around the oral cavity, and the different parts drain into these lymph nodes. So buccal mucosa, again submental below the chin, submandibular under the mandible, is drained into these lymph nodes. Alveolar ridges drain into again submental, submandibular nodes, and also the lingual upper aspect and the cervical and retropharyngeal nodes. So all these are the lymph nodes where the lymphatic drainage of the oral cavity drains into. So the common are the submental, submandibular lymph nodes, then we have preauricular lymph nodes, and then there are the one other structure is the excuse me, we have the lingual upper aspect goes into cervical and the retropharyngeal nodes. So these are main 5 groups of the lymph nodes where the lymphatic drainage of the oral cavity drains into. Then the other is the lingual lower aspect, it drains into submandibular lymph nodes. So this is the lymphatic drainage of the oral cavity, mainly submental, submandibular, retropharyngeal, and then we have infraparotid and preauricular lymph nodes there where the lymphatic drainage from the oral cavity is drained. So this diagram you can see all these different lymph nodes which drain where the lymphatic drainage from the oral cavity drains into. Again, the lymphatic drainage of the oral cavity, hard palate, drains into cervical and retropharyngeal nodes. Retro is behind the pharynx, so we have retropharyngeal lymph nodes. Then the also anterior part of the hard palate goes into submandibular lymph nodes. Floor of the mouth goes into submandibular lymph nodes. The tongue drains into submental and jugulo-omohyoid lymph nodes, and then we have ipsilateral on one side, submandibular and cervical nodes. So this is the drainage side of the tongue. And also the central part goes to the cervical node. So this one by one we talked about the lymphatic drainage of all the different structures of the oral cavity, mucosa, then we talked about the tongue, lips, then the hard palate, floor of the mouth, all these structures. And what we found out after all this is the main lymph nodes where the oral cavity drains into is the submental below the chin, submandibular below the mandibular joint, then we have cervical lymph nodes. All these lymph nodes get drain the lymphatic drainage from the oral cavity. Again, this is the picture. We have the preauricular behind the ear. These are the preauricular lymph nodes. In any infection, when there is abnormality of the structure or there is infection or inflammation going on, usually the lymph nodes become swollen and they swell up, and there is pain and tenderness in the lymph nodes also, and these are all the sites where these lymph nodes can be felt. The method of feeling these lymph nodes is usually the physician stands on the back and use the 3 fingers to palpate all these lymph nodes, and even the patient themselves, they can feel the lymph nodes which are movable and they are tender when there is infection or inflammation in the oral cavity. So because these are the lymph nodes which are involved in the disorder of the oral cavity. Then we have other cervical lymph nodes in the neck. These are the cervical lymph nodes. And then we have the vascular nodes here, submental under the chain lymph nodes. These are all the lymph nodes that drain the oral cavity. Disorders of the oral cavity. Infections is one very common disorder that can affect the oral cavity. So different infections, immune disorder and trauma to the oral cavity is another disorder. Neoplasm of the mouth or oral cavity, skin disorders, blood disorders, leukemias, which are known as the blood cancer, is also blood disorders affect the oral cavity. Drug allergies, very common again, also different drug allergies. People using some antibiotics, sometimes they develop small ulcers in the oral cavity, and because of the allergy, drug allergies. Then we have vitamin deficiencies can affect the oral cavity also. Miscellaneous like chemotherapy and patients who have diabetes mellitus, they usually present with the disorders of the oral cavity. So all these are common factors or risk factors, we can say, that can lead to the disorders of the oral cavity: infections, leukemias, allergies, neoplasm. Then we have trauma, immune disorders, chemotherapy and the diabetes mellitus also. In diabetes patients, usually if they have infections, the infections take longer to recover. So these infections, diabetes can cause oral disorders also. Chemotherapeutic drugs, they lower the immune system of the body and cause more disorders. So all these are the common risk factors leading to the disorders of the oral cavity. So this was all about section 1, in which we mainly talked about the anatomy of the oral cavity and also the lymphatic drainage, the different lymph nodes which drain the lymphatic fluid from the oral cavity, and how they affect and what are some risk factors that can lead to the disorders of the oral cavity. So thank you for watching sqadia.com.